Welcome to Community Connections. I'm your host, Mirchaye Sahlu. In this episode, we're focusing on a critical topic, mental health. During her presidency, Councilmember Kate Stewart made mental health support a top priority, spotlighting the resources and options available to residents so they can get the help they need. Today, we're highlighting the outstanding work of 3 community organizations. First up, we visit MoCo Pride, an LGBTQ+ advocacy organization working year-round to build safer, more affirming communities in Montgomery County.
3, 2, 1!
The grand opening of the Montgomery County Pride Family Resource Center was recently celebrated. At the heart of this work is Philip Alexander Downey.
The mission of the MoCo Pride Center is to ensure that every LGBTQIA+ person in Montgomery County, Maryland, and the region beyond the entire world can live authentically fulfilled, can discover themselves exactly authentically the way that they are. And mental health fits into that because safe, affirming environments where people can grow up as they were created to be is, in my opinion, at the crux of a lot of mental health issues.
At the MoCo Pride Center, mental wellness is not an afterthought. It's at the heart of everything they do, from support groups and referrals to crisis intervention and community care.
Mental health is an extremely important focus for the LGBTQIA+ community because unfortunately our mental health comes in almost every measurable category are greatly impacted and often diminished. Suicidality rates are significantly higher among LGBTQ youth, and if you compile on the factors of those individuals being black or brown or from a religious minority or from a small cultural background, then the rates of thoughts of suicide, of eating disorders, of poor mental health, of depression exponentially increase. And so we need to ensure that we are creating environments and affirming spaces and systems that uplift the identities of all people. The Montgomery County Pride Family MoCo Pride Center, Inc., we are the consortium of advocacy, arts and culture, and service organizations that serve Montgomery County, Maryland, and the region, and we're comprised of 8 different community organizations that all provide their own special brand of services, whether it's linkage to care or direct mental health support group.
The center's goal is to normalize mental health and encourage folks to seek help without feeling shame.
And people often suffer in silence, and issues are exacerbated instead of being alleviated. And so we want to make sure that we're always having these conversations, not only in spaces like this, but at home with your parents or with your guardians, with your kids, with your siblings, that we're all letting folks know that it is all right to not be okay sometimes. It's more so how we address and deal with the problems and how we move on from there.
Next, we spotlight the Black Physicians and Healthcare Network, a county-wide collective of Black doctors and healthcare providers committed to advancing health equity.
Get that for the men.
Across Montgomery County, the Black Physicians and Healthcare Network, known as BPHN, is building bridges between the community and care. A program of the National Center for Children and Families, BPHN, connects residents to culturally responsive healthcare, addressing not just physical health, but mental and emotional wellness too. Janelle Martinez is the administrator of the program.
The mission of the Black Physicians and Healthcare Network, it really is a model to address and decrease health disparities. specifically for the Black residents of Montgomery County. Even though Montgomery County is a very healthy county compared throughout the state of Maryland, it does not fare well for the residents, the Black residents of Montgomery County. So this whole mission is to help bridge the gap, address some of those disparities, and ensure there's equity and access to healthcare services for Black residents in the county.
Research shows that having a healthcare provider who understands your lived experience and even looks like you can lead to better outcomes and deeper trust.
And that is, again, that's all part of our service delivery. So what it looks like in practice for us is we have a network of about 205 Black health providers right now, whether it's medical, dental, or mental health. So what that looks like is if you come in and you want something, you want services, you want medical, dental, or mental health care, we're going to connect you to a BIPOC provider. All of our professionals are licensed at the level that they need to be licensed at as health professionals, but it just looks like creating that sense of trust, like, hey, I am here for you. They're able to offer culturally specific care, and even just having that cultural competence for them, because I identify with you culturally.
Program Director Robin Little explains that for many, mental health remains one of the hardest conversations to start.
In the Black community, there's always been this, I don't want to really use the word stigma, but it's been like a taboo, hush hush, don't talk about mental health in the Black community. But what we see is that there are plenty of people in the Black community. Not only do they want it, they're in need of that type of care, and BPHN has been able to offer that, and that helps make the community safer and stronger.
It's a holistic approach, meeting people where they are and helping them navigate the care system without judgment or fear.
They do a full questionnaire and health scan, and it also addresses any other health disparities that they may have.
And the impact is already being felt across Montgomery County. Through outreach, education, and connection, BPHN is changing the conversation around mental health and rebuilding trust in the process.
Our impact in the community has reached over 100,000 people in Montgomery County. You know, we are an organization that really sees that there's a need to reduce disparities in Montgomery County.
And everyone has a role to play in keeping that work going.
We educated all of our navigators to be able to be community health workers, and that helps them to be a part of a case management team that allows them to make sure we're having positive outcomes with our clients that come to us.
To learn more or get connected to CARE, visit their website. Because when care reflects community, healing begins.
And finally, we bring you to Vibe Checkup, a creative, youth-centered program helping teens tune into their mental well-being.
In a world where young people are constantly online, sharing, scrolling, and navigating pressures every day, one local program is changing how we talk about mental health. It's called Vibe Checkup, an award-winning, youth-centric mental wellness platform that's helping teens check in with themselves and with those who care about them.
Vibe Checkup, the power of checking in. What's your vibe? It's a mental wellness platform for our youth 6th to 12th grade, and we have several different kind of programs. We have a podcast, which is absolutely amazing, which allows our kids to talk about what's important in their life, because our kids say they don't feel heard, they don't feel seen, and they don't feel supported. So this is a way of getting them to talk about what's really going on in their lives. And I love it because they're talking about stuff and they don't even realize they're talking about their mental wellness.
For Kimberly Fogg, this mission is personal, shaped by her own background in community health and her belief that early intervention saves lives.
I became a mental health first aid trainer. And so I started training like some of the teachers in MCPS, and I kept saying to myself, everybody is providing this kind of training for the adults. What about the kids? what separates Vibe Checkup is that it's all about real talk. The podcast I talk is called Real Talk. Like, what's your vibe? Real talk. Let's really talk about stuff as opposed to skirting around it. So and it doesn't feel clinical, going in and seeing a person that you don't know can be a little daunting for kids, and they're just not going to open up to anybody, and I just think that that's why Vibe Checkups has been so successful, is because I came in and I just sat back and observed and let them come to me.
I really need to get that off my chest. Like, that has been reminiscing and just, I need it. It's been brewing.
I just need to say thank you so much, because it felt like a weight and like a burden was like left off my shoulder. Like, somebody finally listens. Like, you're about to cry.
Oh, I don't want you to cry, honey.
Social media, podcasts, and real-time tools, the platform makes wellness accessible, relatable, and even fun.
The wonderful thing that I love about the podcast is that not only does it just kind of definitely shares what the kids are thinking about.
And I also want to say thank you, because like I have a place where my voice can be heard by people who think just like me.
But it also is it's a great piece for parents and teachers to really see and hear what the kids are talking about and what they're thinking and how they're feeling.
They are also picking up new skills while they're at it.
Now they know how to produce, they know how to become moderators, they know how to write their own scripts based on their conversations. And what the beautiful thing is about that is they're having conversations with each other, and now they're coming up with solutions, right? And coping skills.
I didn't know why, but here is my social anxiety become very, very small. It's like become a very little part of my personality.
At the heart of the program is the Vibe Checkup app, where students can log how they're feeling, track their moods over time, and share updates with trusted adults like parents, teachers, or counselors. It's private, supportive, and designed to build connection, not surveillance.
Every morning you've got to come in and you've got to pick your emoji. But like if you're happy face, a sad face, whatever that is. But you just can't do that. You actually have to journal how you feel.
Since launching in 2022, Vibe Checkup has reached schools and youth programs across the county, improving communication, reducing stigma, and helping teens find words for what they're feeling.
The kids are coming out of their shell, and they're learning how to express themselves. And I really think that when kids can't express themselves, that's when they go inside. It's all about that ecosystem, because it's not just about, making sure that the kids are okay, but it's making sure that the people around them are supporting them in the way that is gonna make change. Because it really turns into like a lifeline. That's kind of how I look at it. Because when kids don't feel supported or valued or heard, that's when it goes off the rails, But if you just show them hey, listen, we got you, we got your back, and that's when that change happens.
Through innovation, compassion, and a deep understanding of today's youth, Vibe Checkup is reminding us all that checking in can change everything.
I feel like with Vibe Checkout, you get to say all the things you never fully got to say, you know what I mean?
Starting at the beginning of the year, I feel like I wasn't really as connected to people in my school. So just being in that type of environment where they're always so welcoming and they're so open, it was a really good experience. And I felt like me growing in that kind of environment made me more open to make other people feel as happy as I was being included in stuff like this.
For more information, visit their website.
Well, that does it for this edition of Community Connections. For County Cable, I'm your host, Mirchaye Sahlu. Thanks for watching.